Good day and welcome to our podcast, Elevating Today. My name is Aakash Patel and I'm the founder and president of Elevate Inc. We are a strategic business consulting firm helping companies who relocate their headquarters and entrepreneurs that are starting our new businesses here in the Tampa area. Dr. Jerry Beinhauer is our guest today, and he's with Simply Smart Health, and he's an amazing physician who's also an entrepreneur that has started several successful businesses in the Tampa area, and we're going to talk about a few of those. At Elevate Inc., we try to tell our clients that it's important to network, get out there and meet people. Now, during this pandemic, it's been really tough, not only just personally, but also professionally. And so one of the biggest challenges we've heard is the awareness of mental health. So on that note, we sponsored a breakfast, socially distanced, of course, on November 10th at the Center Club in West Shore, where we featured Dr. Raul Mera, a child psychiatrist who works with mental health awareness and employee benefits. So we wanted to showcase, here's a photo of that event, and we want to thank our clients and guests for attending. If you're interested in learning what happened, you can visit our website and read the blog recap on what was discussed. But we want to assure you that these are the events that are making a difference in the Tampa area. And we have several more of those going on, and we'll always be updating our website at elevate-inc.com. And you can always email us or contact us at info@elevate-inc.com if you have any suggestions or want to be featured on this podcast. Again, my name is Aakash Patel. We really appreciate you following us on LinkedIn, Twitter, Instagram, and all the other social media platforms. We appreciate you watching us, and here's our interview with Dr. Jerry Beinhauer. Good day and welcome to Elevating Today. This is our weekly podcast where we feature our clients and guests that are helping our city. And this is episode 8, season 1. We appreciate you joining us today. And I'm so excited to have my friend, Dr. Jerry Beinhauer, with us today. Jerry, how are you?
Good, Aakash. I appreciate you having me on today. This is awesome.
Of course. Now, a lot of folks viewing today have heard the name Dr. Jerry, of course, because it's a very famous name in this area. But for those who haven't, tell us a little bit about yourself and how you got to your career path.
No, absolutely. So I'm a physician, but a techie nerd, and always have been involved kind of in technology stuff all the way back before medical school. I was a network engineer as well, which kind of helped me through medical school because everybody always wanted to hire me to do tech stuff. And as a medical student, you'll do anything for money or food. So it really helped out a lot. But one of the things that we found, through the course of working on that kind of stuff is that there was really huge problems in healthcare, and it sort of became a curse for me to try to find a way to fix those, which kind of led us to where we are today with Simply Smart Health.
Now, before we get to Simply Smart Health, tell us about your passion. Why is healthcare important to you personally?
So I think, one of the things that really jumped out at us that made us take this path goes back to my wife's experience as a patient. She had a brain tumor.
Oh, I'm sorry to hear that.
Yeah, and it was benign, which is fine. But during the time, we didn't know that. And that was, I wrote this, on our website as kind of our why story that led us to this path, specifically for Simply Smart Health. And what we realized in that process is here I am as a physician, and as a doc, I have the ability to pick up the phone and call other physicians, and we found that she had this brain tumor. I wanted to find the best doctor in the country that can operate on my wife, of course, which anyone would.
Yeah.
And even having that ability to pick up the phone, talk to docs, get them on the line, we got her into a really tremendous surgeon right here in Tampa, at Tampa General, did a great job. And she and I reflected on that and said, what do people do when you're not a physician? And it really called out to us that the healthcare system is really broken, and that usually a lot of that burden falls on the patient and their family to try to decide how they're going to navigate the system. We felt like that was one key area that was missing in healthcare that we needed to fix, set aside all the other problems related to financial aspects as well. So that was kind of a big reason why we decided we needed to create a solution that kind of provides a concierge type service for the patient.
And Simply Smart Health, as you know, is doing great things. But tell us how it stands out from your competition.
So the thing that we realized, again, was healthcare sometimes seems to disconnect between the patient and the services and the providers. One of the big things, too, that I've always felt as a physician that kind of irked me is that, the fundamental event in healthcare that drives everything is the physician-patient interaction. And this whole big multi-trillion-dollar industry has been built around that. And I felt like we needed to find a way that actually brings those parties back together and kind of creates a localized solution for healthcare within a market. So really bringing healthcare back to home. And that's really the big differentiator, I think, with Simply Smart Health is our focus is bringing local doctors, hospitals, health systems together with the employers, which are typically the ones that are facilitating different types of health plan coverage for their employees within each one of their communities. That's a big differentiator for us, in addition to the fact that when I put my tech hat on, we built a bunch of integrations and technology to help facilitate that and streamline it.
Now, a lot of people are probably thinking, well, this is a pretty simple concept, right? What what do you think is the biggest challenge you're facing today?
So I think the biggest challenge is for people to realize when we're out telling people about what we do, healthcare has been broken for so long, and basically the players have been groomed to think that you can't really change it. So we're always, our biggest hurdle is the status quo. So COVID has actually helped us with that. And the reason for that is because there's basically two camps now. There's employers that have had a tremendous financial impact because of COVID. And those executives, CEOs, CFOs, what they're telling us is that, we've got to find ways to cut our overhead, cut costs. And there's certain industries that are affected more than others that have had difficulties financially. And when we're talking to them, they're telling us, they said, we may negotiate to try to get 10% off of our mechanics uniform, so if they're a car dealership, just to get a reduction in their expenses. But we never thought that we can actually lower our healthcare costs, which is usually their number 2 or 3 expense overall, without actually reducing benefits. So they still want to deliver really sorry, can we edit this out? So they really want to deliver high-end benefits to their employees, but they never thought they could do that through healthcare cost reduction. We're showing them that they can do that, and it is possible.
Yeah.
So then, on the other camp is employers that actually then are faced with a challenge today. Those employers are having challenges where they now have a distributed workforce, which creates a whole new set of problems for them, because employees now, typically, they may have had an office in Tampa, and they're recruiting for workers in the Tampa Bay market, and that's sort of their geographic limitation of where they need to look. But now an employer in Tampa is actually competing nationally with every employer, because most folks are working remotely today. When they have a distributed workforce across the country, that also puts challenges in front of them on how they're going to deliver benefits to those employees. So the nice part about what we've done with Simply Smart Health is to address both the cost side of the equation and also help address the challenges for those employers that now have to operate in this distributed national workforce environment.
So Simply Smart Health, as you just described, you're targeting a certain employer size. Talk to the audience here about who you're looking for and what's a good introduction for you.
Yeah, so typically the employers that we work with have about 100 employees or more, some a little less, maybe down to 50. And the reason for that is because what we're seeing is those size employers really have to get the most bang for their buck on cost reduction. Right. When you look at the statistics today, most employers are spending about $10,000 per employee per year for healthcare costs. So when you take an employer with 100 employees, it's about $1 million a year of their expenses are going directly towards healthcare. When we're coming in and showing them how we can implement the Simply Smart Health solution and cut those costs by 25, 30%, and actually improve benefits, that's a lot of cash that actually just stays in their coffers. Some employers are using that money to hire new workers. Some of them are actually steering that towards other initiatives that they were putting off. Some of them are donating that cash to nonprofits, which are struggling really hard today.
Yeah, I want to talk about that. I know you just recently supported the American Cancer Society with your family, and that was exciting. So tell us about your community involvement and why you give back.
Yeah, so one of the things that we realize is for us, this is a mission. It's a cause. We're doing good for a lot of folks, not just the employers, but also the individual employees and their family members. So our thought had always been is how do we leverage what we're doing from a cost savings perspective? Providing a better experience in healthcare is key, but then because we're able to lower their healthcare costs, can we do something more that can help kind of leverage what we're doing to spread that good even further? And that's when we thought about the nonprofit, connection, because what's happening is, and a lot of people had seen this, is a lot of the nonprofit organizations had relied on donations from corporate sponsors. Well, when those corporate sponsors don't have the financial wherewithal today because of COVID or whatever reason, they can't donate to some of those nonprofits anymore. So our thought was that we can help unlock found money from some of these employers by lowering their healthcare costs. They don't have to do it, but is that enough for them to maybe take a portion of those savings and support another cause? And we're seeing a lot of employers are very interested in that.
So if there's a nonprofit out there watching today, what should they do to reach out to you?
They can contact us, go through our website. That's usually the best way. It's simplysmart.health, simplysmart.health. And we're happy to talk with them and see how we can help them further raise capital to support their cause by working with some of the employers that want to support those nonprofits.
And you're a father, you're a husband, as you mentioned, you're a doctor, and you still practice in a hospital, and you're a tech CEO. So how do you work-life balance and with everything you got going on?
That's the tough part for me, probably. It's like, this Simply Smart Health has been such a major mission and cause for us, and my family is actually involved with it, which is good. That helps a lot. So, it's more than a family business. We have folks that are involved, across the gamut, but, my family is involved helping as well. And it is tough, but I think the thing that drives us to do it is to know that, we're doing more than just providing a service. We're actually doing good.
Right. And so, your success in this business, I mean, you've been out in the innovation community in the Tampa area. What's special about this community for what you're doing?
So I've seen a lot of change in Tampa over the years. So I've had, several companies that we started and here in Tampa and built, and definitely, there's been major changes probably over the last 5 years from a funding perspective, some more organized funding, incubators. So we're actually a part of Embark Collective here in Tampa. So I'm familiar with the incubator.
Of course. And how's that experience?
It's been great. So it's really awesome. The resources that they have for us and support and bouncing ideas off of the folks there. They're always willing to help. So I think Tampa is really positioning itself more and more as really a startup tech hub, which is awesome because Florida as a whole and the Tampa market historically has always had a stigma that it's not the place to start a tech company. That's changed.
That's great. And I think the events that, I'm on the board of Synapse, and I know you were a big sponsor of Synapse this past February, and those things like that are really getting the tech map, Tampa on the tech map for nationwide, for sure.
I agree. Yeah.
So now talk about being an entrepreneur. I mean, every entrepreneur goes through a business plan and challenges, and there's a lot of, as you know, with this pandemic that just hit us, there's a lot of people that are starting businesses to kind of get their name out there. What are some advice that you would give, that you've learned, lessons learned from you starting your several companies?
So I think the key is don't be afraid to fail and fail fast.
Okay.
And focus. So basically what we've learned is that, any startup company is really a learning experience and you have to approach it that way. And what you think you're going to be doing when you start is probably not what you're going to end up doing at the end. And as long as you realize that and the folks that are involved with you know that that's our plan is to continually to learn, then I think that usually helps put you on the right path to product market fit and a successful business.
Well, today's 2020. I know that's a year that a lot of people want to forget, but 5 years from now, if we're to look at this tape and say, what was your prediction? What do you think, where's Simply Smart Health and where's Dr. Jerry going to be in 5 years?
Yeah, so our goal with Simply Smart Health is to make a huge impact on the lives of people through the health plan solution that we put together. What I can see in 5 years is that we've provided that and we're continuing to grow on a national scale to actually impact more lives across the country, starting here in Tampa, expanding into the Southeast, which is what we're doing now, and then going national. Wow,
and that's so exciting that you're starting here right in our backyard. Now, I know a lot of people out there are watching and they just saw you on LinkedIn and or on social media, and you just did a campaign. You participated in, is it Real Men Wear Pink?
Yes. Yeah,
for the American Cancer Society, and you're wearing pink today, so it's perfect timing. I'm wearing a little different shade of pink today, but talk about why that's important to you, that cause, and how you got your family involved.
Yeah, so that was one of the things. So I have 5 kids, like I mentioned. I have 3 boys and 2 girls. And our family's been impacted by cancer in general, but breast cancer as well. So, my boys and I, they had felt the impact of cancer because of family members. And they say, what can we do more than what we're doing now with Simply Smart, but specifically focused on the cancer stuff. And when we learned that through COVID, American Cancer was having a tough time because they weren't getting the donations that they were before. Most of their funds came from corporate sponsors and also events,
right,
which they weren't able to have. It's just our thought was, could we participate, at whatever level we could? So me and the boys, participated in the Real Men Wear Pink campaign here in Tampa. I was proud of them. We raised significant dollars. I think came in 4th.
Congratulations.
In the Tampa Bay market. But it was a lot of fun, and I would encourage anybody to do that. With the American Cancer, there was some fun competition back and forth, between us and some of the guys, all in good nature. But it was really exciting and to be a part of that and encouraging. So I would encourage anyone to participate in that every year. We're going to do it.
And your experience in the medical field, I mean, technology is a big part of healthcare, as you can imagine. But where is healthcare going? I mean, where do you see the trends?
It's really tough, I guess. I think really the healthcare in general needs to be focused and is moving more towards patient experience. And I think the key is we're going to see more consumerization of healthcare. And I think the winners are going to be based on who can deliver an experience that patients like. So if you're a healthcare provider, a hospital or doctor, and patients are looking for where's the best place for me to go, quality is key, but also providing an experience that feels like similarly to what you would get when you were shopping for some other type of service or product. You got to make sure that you're delivering the experience that they want.
I know you talked about your customers during COVID-19 and how they're impacted, but you were still a physician. You're still practicing in a hospital, right? So, what's it like? To walk us through what was it like when March 13th hit and today as a COVID physician?
It's pretty scary. One of the things that impacted me a lot when I was working in the hospital which was tough. So a lot of the hospitals during the COVID spike, no visitors were allowed in. Right. So there were people dying alone. Wow. So if you can imagine older folks, which most of them were the ones that were the sickest. I had a patient that was 92. Him and his wife had been married for 60 years. He died alone. And I would talk to his wife every day. Eventually we set up a Zoom, and for her to see him. He sort of knew she was there, but not, and it was just a little thing that we could do. I ended up petitioning the administration to be able to let family come in if that was happening, and we were able to set that up so that at least family members, one, could be with a dying family member that was there dying on hospice.
Oh my God!
So that was probably the toughest part. So, and I'm sure anyone that's been through that could appreciate that experience is terrible.
Now, the hospital system has to have changed because of COVID-19. I mean, how did it affect you and your team and your nurses and all the first responders, which we're so appreciative for?
You can see that, you can feel the stress in the hospital because of it, even still today. So everyone's, is wearing masks, shields, gloves, gowns. The days, I wonder, if the days of kind of that close interaction without PPE will ever be there again. I doubt it.
In a hospital.
In the hospital.
Yeah.
So that's definitely different now.
It's an incredible. It's a transformation of what you used to see as hospitals and what we used to experience for sure.
Yeah, I used to sit down at the bedside. I have to kind of stay a little bit back now, and touch. And with the patient is always kind of a big part of that. I noticed that it's a little more. Everybody hesitates now.
Now, you were talking about the different spike in cases in the areas around the nation and then the urban and rural areas. Talk about the change you've seen.
Yeah, so I think, what we saw in some of the hospitals where we provide service in the rural areas is when, the first COVID spike came in the big cities, we didn't see a lot in the rural areas. Then shortly thereafter, it spiked. We started to then see that decline, but actually now we're starting to see an increase again.
Oh man, well hopefully it's short-lived, right?
Exactly.
And we'll get a vaccine soon, right?
Oh,
and we'll work on that?
Yeah, right. Not me. That's me above my knowledge level.
But no, I really want to talk to you as an entrepreneur. A lot of entrepreneurs are like I said, they're thinking of starting their own business, and you read a lot, right? Mm-hmm. So you've read a lot about business books and things like that. So what's a book that you've read that really transformed how you're shaping Simply Smart Health, and what's a book that all entrepreneurs should read?
I think there's several that I think were really impactful for us. Start with why.
Yep, Simon Sinek.
Yep, 0 to 1 is probably some of the key things, and Lean Startup.
Lean Startup. Okay, who wrote that?
Oh gosh.
I know the name. I know the book anyway. So we'll put it on the screen.
Yeah. So and basically it's like all focused on startup life and making sure that you focus on getting to that first customer, and then also operating in a lean way, pivoting, learning, kind of what we talked about a minute ago.
Well, that's exciting. I think you're doing all the right things, and I think Simply Smart Health is in the right trajectory. And you were talking about, national, and I guess, at some point, maybe go international. You never know, right?
Exactly. You just don't know, exactly.
But I think, you've done a lot of seminars as well, a lot of talks, and when you talk to a lot of entrepreneurs, your determination and your persistence shows, which I appreciate always about you. And where does that life lesson come from? Was that from medical school that you were always taught that you can't give up and you must?
No, probably early on. So I didn't come from a wealthy family, so we were a hardworking family. And if we wanted anything, we had to work for it to get it. And I think that's kind of driven everything that I've done through medical school. People have told me, and this is another thing for entrepreneurs, people always tell you can't do it, that's not for you. To me, that just energizes me. It makes me want to do it even more.
Yeah.
So I think that's the key is to continue to drive, have that focus, and never quit.
Yeah, I just wrote an op-ed in the Tampa Business Journal and said, if you don't ask, you don't get. You've got to ask for what you want.
Yeah.
So if you're looking for that customer, just ask them.
Exactly, yeah, that's
But no, I think there's a lot of things we talked about today. We're a little short on time. Is there something that I didn't get covered that you wanted to talk about?
No, I think that's really the key. I think the key to employer is we're here to help. That's kind of how I view this, is that even though we're put together a solution that delivers value, at the end of the day, we have a lot of employers that we interact with that aren't quite ready to make a change from their status quo. And what we realize with them is that we're here as a resource because health insurance is complicated, they have a tough time understanding it. And what we're finding is that with us being here to help them navigate the current system, I think we're kind of poised to help them eventually realize significant savings and a better experience for their employees.
And we were talking about brokers earlier because they can help you, right? Healthcare brokers?
Yeah, we work with brokers. So that's one of the things that we realize is, brokers need, this is what they're telling us, is that they really need an innovative solution to help their clients because they want to make their clients' business successful as well. And if we can help them through our solution lower their clients' costs, that helps them look like a hero because they're bringing a solution that's going to help their client's business overall.
So if there's an employee benefits broker watching us today, they could reach out to you as well?
Absolutely. We have brokers that are selling the Simply Smart Health Plan now.
And then you have like an agreement, or how does this work next?
Yeah, so we set it up so it's really easy for them to engage with us, similarly to if they were selling a plan from another organization, which a lot of brokers have a lot of different options in their briefcase. Simply Smart Health is one of them for them.
And so, obviously you're the face of the business, you're the CEO, you're the one who put the plan together. How important is it for you to set up a team so you can do what you like to do and then have the team do the rest?
So team is key, and that's one of the things that I learned early on is that you can only do so much, by yourself, and really you have to put together a core, solid team to do that, and that's what we've been working on steadily. My view always is to create the framework, then put together the team, and then let that team help steer the direction. And that's the phase that we're at now, is we put together the framework, the product, the offering, and now we're putting together more of the core team to actually steer it further.
Well, Dr. Jerry Beinhauer, thank you so much for joining us today. And we are so excited about Simply Smart Health and the future you have in this community, and not only this community, the nation, and hopefully internationally soon. But we'll put your information on our site. We'll put your website, your email address, and hopefully the viewers will reach out. We appreciate you being here. Thanks so much.
Thanks, Aakash. I appreciate it.
This is Aakash Patel with Elevate Inc., and you've been watching episode 8 of season 1 on our podcast. Thanks so much for joining us.